Hello, can you introduce yourself?
My name is Renee Kinder Frazier.
Hi, Renee. How long have you been a nurse?
I've been a nurse for 26 years.
How long have you been a psych nurse?
I've been a psych nurse for the last 10.
Where was your last place of work?
Ancora Psychiatric Hospital.
What kind of nursing did you do before Ancora?
I worked at the Bridgeton Nursing Center, which is a long-term care facility.
And then?
And then I moved to Vineland Developmental Center Hospital, which is a facility for mentally disabled or mentally challenged patients.
And what made you make the change from mentally challenged patients to psychiatric patients?
I thought that I needed a change, and I thought that psych nursing would offer me that change and also be a challenge.
Do you regret making your switch?
No.
So you enjoy psych nursing?
Yes, very much so.
What do you enjoy the most?
I would say the satisfaction that I get from the patients while they're receiving their care. They're very grateful.
So what is the hardest part of your job?
The hardest part of my job is probably dealing with the patient when they first come in, because they haven't had a chance to have a completed evaluation, and they don't have any medication, so their behavior can be erratic, violent, unpredictable.
What qualities do you think that an upcoming psych nurse should have?
I think upcoming psych nurse should have an exceptional amount of patience and understanding, as well as a sense of humor.
So what is your typical day as a psych nurse like?
A typical day would start out as all the patients coming up to the medication room to get their medications, which were given out at various times of the day, usually 8, 12, 4, and 8, with a few odd hours in between.
Okay, and then?
We would have patients seen in what was called as mini clinic, when the doctors came up to the floor, medical doctors, psych doctors, to examine the patient for whatever medical problems and or psych problems that were the issue that day. If there were any behavior problems, in between their breakfast, lunch, dinner is served. A typical day would also include a meeting with the psych doctor with patients on an individual basis, which was part of their treatment plan.
Have you sustained any injuries being a psych nurse?
Yes, I have. I have been physically attacked a couple times. I also sustained an injury while helping a patient on the floor that had a medical code. I bent down, and upon getting up, I swiveled around and tore the meniscus in my left knee.
Okay. Any violence to you? Any punches to the face, kicks?
Yes.
Black eyes?
A couple punches to the face, no black eye. As I said, a couple punches to the face. I was kicked in the knee by a patient, which did not enable me to run. So, if anything, I can walk fast, but can't run.
So when you get attacked by a patient, are you allowed to hit them back?
No, you are not. You are taught various methods of maintaining control, getting control, and keeping as much violence from occurring as possible.
Okay. What did you have to do to become a psych nurse beside your schooling?
I received on-the-job training when I first transferred to Ancora Psychiatric Hospital.
So you didn't have to get certified, you can just get training?
Now you have to get certification.
But since you're old. I'm kidding.
Oh, you got jokes. Things have changed so that incoming nurses are required to have more training.
Okay. How has psych nursing affected your life personally?
Well, it's given me the ability to develop a greater sense of patience and to learn how to deal with everyday life in general.
Okay. With all the risk factors like getting injured or coming home with an intense amount of stress or going to work with an intense amount of stress, what is the most rewarding part of your job?
I would say the reaction or the feedback that I get from my patients.
So, what is the craziest thing you've ever witnessed as a psych nurse?
One of our patients, or several patients, being diagnosed with water intoxication, meaning they will drink water from anywhere. They will fight, bite, scratch, pinch. They'll do anything so that they can get to water, including drinking water out of the toilet. They will take a cup out of the trash, put it in the toilet, get water, and you will have quite a fight on your hands in order to get them away from the water. But they'll drink it to a point where water's coming from every opening in their body. They will drink excessive amounts. Extremely excessive amounts, so that they will throw their electrolytes off. Everything is off, and they can be hospitalized. They can even appear as if they're drunk.
What would you be doing if you weren't a psych nurse?
The only other thing that I would have liked to have tried and I did not was to work at a critical care, a burn unit, or I would go back to the assistant instructor of nursing services and continue to teach.
Oh yeah, that was what your last job was at Ancora Psychiatric Hospital, right?
Yes, the last 2 years.
And what was that like?
It was a lot of fun. Got a chance to meet a lot of people and orient them to hospital policy and procedure, how to work with our patients in an extreme medical emergency or a psych emergency. It was a lot of fun.
Okay, Renee. Well, thank you for your time. We enjoyed having you today.
Thank you.
I'd like to see you back sometime.